Do the practice exams, resources. I don't know if how extensively you guys have been looking into previous exam cases or not. So as I mentioned before, ACRRRM ran the mock StAMPS exam just a couple of days ago. Usually what happens is that they'll try and run it very similar to the exam. However, there's only 3 scenarios with that mock exam, whereas the real exam has got 8 scenarios, but it gives you a bit of a feel for the kind of questions that they'll ask, and also they give you feedback after doing all 3 cases. The ACRRRM Rural EM Forum, if that's something that you guys have been signed up for, or if you haven't, please look it up, Google it. You can access it through your ACRRRM online access, and I'd highly recommend it. It's got lots of cases by people who actually write the exam questions, so it gives a really good idea as to what kind of things they're thinking about, what kind of answers that they want, and you can just answer some of their questions and pretend as if it was the exam. There's lots of cases on there from the last few years, so have a good look through them. I'd also recommend making sure that you've gone through your ACRRRM Romeo modules as well. They do have quite a few important ones. Definitely the flagged ones are the ones to do. If you don't know what I mean by the flagged ones, please put it in the chat box and I can talk about that at the end of the webinar. Your GP training provider hopefully has some ACRRRM StAMPS exam scenarios or mock exams. I know GPTQ does, and I found it very helpful. It was basically exactly like the exam itself in relation to the number of cases, how they ran at the time, that kind of thing. I myself have a lot of practice examples, and am happy to share with anyone if you'd like to get a few more exam questions. I'm happy to email them through at the end. Again, let me know what your email address is if you're interested in that respect. And there was also on the ACRRRM Registrar Facebook page, they posted, I think it was a 90-page document with multiple different cases and scenarios to go through. So make sure you get on the ACRRRM Facebook page and download that, because it's really good. Otherwise, I really strongly also recommend that you make your own cases. When you're working in your day-to-day job, if you can think of a scenario or a case that you can use and make up a question. If you've got a study group with a few other people, even if you do it over Skype, it's very helpful. I did that with a couple of my friends, and that was really good. We just met up once a week on a night that was agreeable to most of us, and we just ran through cases, case after case, and it's a really good way of practicing. So the week of the StAMPS exam, have you guys been told already where your exam is and what date? It's very important. What I will definitely recommend is, I've written it as my last point there, but please make sure that you know what venue you're going to, the time and date of your exam, because there have been registrars in the past who have flown to a capital city to sit their exam, and they've realized the day before the exam they are not in the right town for the exam to happen. So obviously that's just an unnecessary stressful event to happen. So please just check and double check where you're actually sitting your exam, the time of your exam, and making sure that you've got a way to get there. Try and get there early. You don't want to be the last one in. And obviously just making sure that you're practicing as much as you can. If you've got colleagues that can just run by a couple of cases with you and say, you know, what would you do in this case, or what are your differentials? Just running through a couple of scenarios on a daily basis would be quite helpful. And treat the presentations you see at work like the exam question. Think about what you should be ticking off and what they would like you to see or answer for each of those types of questions. And yeah, as I said before, make your own cases, write up some model answers, test them out with some colleagues or friends. I find that a really great way, because there's other aspects that you might not have thought of, or other differentials that make your case a bit more well-rounded. Make sure you do take time out to yourself the week of the StAMPS exam. It can be stressful. Just make sure that you're sleeping well, you're eating right, don't take too many stimulants, I guess. But yeah, just try and make sure that you are calm and collected, essentially. The day of the StAMPS exam goes without saying. Make sure you have a good breakfast, keep yourself well hydrated, and again, check the location of the venue that you're going to, the time, and the transport. Again, parking can be a bit of an issue if you're going to the capital cities, but yeah, just have a second option for your transport just in case. When you go into the StAMPS, well, before you go in, they will usually tell you what starting scenario you are, what number you'll be starting on, and you can obviously take in coloured pens, but you definitely need to take some ID with you. They will supply you on the day with pieces of paper, so there'll be 8 pieces of blank white paper, a pencil. You will be getting the STAMPSville community profile, which I hope all of you know back to front and very, very well, because if you don't, that may be where you will be marked down on. For the STAMPS exam itself, they usually keep you in the same room for the entire exam, so there's less stress on you, and the examiners walk around, they come around for each of the scenarios. I'd highly encourage you to make sure you go to the bathroom before the exam starts, because you don't want to be wasting precious time going for a bathroom break. With regards to the exam, it is video recorded, and that's essentially because if they need to ratify the results, if they need to go back and see if someone was a borderline pass or fail, or just reanalyze a couple of the scenarios, that's how they do it. But it's just a very small camera. Try not to focus on it, just try and imagine that it's not there. There is a timer, and I would recommend trying having the timer obviously between yourself and the examiner to the side, so you're both able to visualize it. Make sure you read the instructions very well. So you'll usually get a little bit of a stem, and it will tell you how many questions there are, and usually how many minutes is allocated to each of the questions. There's usually 3 parts to each stem. Make sure you're checking the scenario that you're starting on. You might be starting at scenario 6, and for some reason ACRRM tends to go backwards in regards to the scenario number. So if you maybe start at scenario 6, then you'll go to scenario 5, 4, 3, 2, 1, 8, 7. I don't know why they do that. I think it's just another way that they can trip you up, but please make sure that you know that you're going in the right direction. And usually they give you a piece of paper which outlines which way the scenarios are moving, but both in my emergency medicine StAMPS and also the primary curriculum StAMPS, they both went backwards. As I said before, you get the STAMPSville community profile, but please know it very well so you're not spending time reading that piece of paper. In the reading time, so you get 5 minutes, well, essentially you get 10 minutes to start with, but what I would recommend is split your time up for 5 minutes and a second 5 minutes. So the first 5 minutes, I would just look at all the other stations, and if you want to write down any pertinent points, if you've got like a template that you're using, if you've got buzzwords or keywords that you want to write down, like culturally sensitive, or using an Indigenous healthcare worker or Aboriginal liaison officer, anything that you think that you might potentially forget or is very pertinent, write that down. And then the second 5 minutes, I would recommend making sure that you look at the station that you're actually going to be starting on and preparing for that one. So yeah, you can write down anything you want, and realistically they can ask you anything as part of the question. So with regards to your writing time, try and be quite succinct. Don't write paragraphs, dot points. And as I said, yeah, if you've got any templates, make sure you use them if you want to. Some people write their whole template out in the first couple of minutes. If you're not sure what I mean by template, again, I'm happy to email a couple through that I've been sent in the past and have used myself. With regards to the marking criteria, hopefully you guys have had a look at that. Essentially for each of the questions, you will be marked basically across 5 categories. And the first one is your overall impression of the case. They don't want you to reiterate what they've just told you in the STEM. They want you to say in a couple of words what you're thinking. So something as simple like, I think this patient is really unwell, they need to be in the resus bay, or I'm quite concerned about non-accidental injury, just an overall impression. The second one for marking is developing an appropriate management plan that incorporates relevant medical and rural contextual factors, taking into account your community profile with STAMPSville. The third marking criteria is defining the problem systematically. Fourth is communication, and fifth is being flexible in response to new information. And they usually use that one in the third and final question. They might give you a question that is totally unrelated to the case that you're currently discussing. They might give you an X-ray to interpret, which is again not related to what you've been discussing, or it might just be an ethical dilemma in relation to the current case. I would recommend you to be confident in your answers, but don't be cocky. I think they do appreciate a sense of confidence in your answers. Obviously, if you don't know, don't make it up. Say where you would go look for the answers. You want to demonstrate that you're a safe doctor, and that's what you'll be marked for. Once the case is over, move on. Try not to dwell on the last case. So yeah, these are the marking criteria as I mentioned. Hopefully you guys have read or heard of the ACRRM public reports. Essentially they post them up after each of their exams, and it goes through how many people passed certain sections, what kind of questions they were asking, or what was the general theme of the questions. And yeah, it's very freely available online, so have a look at it. I'm not going to really talk too much about it, but it also gives you a bit of an idea of what they have asked in the past. This is the STAMPSville community profile, which hopefully you've all seen. As I said, you will be given this